is Raven, and I'm going to talk to y'all a little bit about celiac disease. Okay, so what is celiac disease? Celiac disease is also known as celiac sprue or gluten sensitivity enteropathy, and it is a digestive and multi-system disorder. Whenever someone with celiac disease consumes food that contains gluten, their body creates an immune response that attacks their small intestine. So, over time, this immune reaction to eating gluten creates inflammation that damages their small intestine's lining, which leads to medical complications. It can also prevent absorption of some of their nutrients. And then celiac disease can develop at any age. So, some clinical manifestations in the body. After eating gluten, individuals may exhibit abdominal pain or discomfort, bloating, diarrhea, foul smelling, or fatty stool, which is caused from the malabsorption of fat. They may also exhibit anemia, weight loss, failure to thrive, especially in children, brain fog, and then they can be asymptomatic for a third of people. And then on the left here, I have a little diagram of some other things that you may see. So they may have brittle nails, acne or eczema for intestines, like I said, diarrhea, bloating, constipation. In females, they may exhibit infertility, miscarriage, or they may have early menopause. And then they may have ulcers and tooth enamel erosion, which ulcers are just common with autoimmune disorders. They may also have joint and muscle pain and swelling, and then stomach, of course, pain and nausea. Okay, and then diagnosing celiac disease. Many people don't even know that they have it. Researchers say that as few as 1 in 5 people with the disease ever find out that they have it. Damage to the intestine happens so slowly, so the symptoms can vary a lot from person to person. So it can take years to get a good diagnosis. Once celiac is suspected, in order to diagnose, they may do a series of tests to confirm. In order for the test to be accurate, though, they must have gluten in their diet so they can see exactly how it affects their body. So if you're already on a gluten-free diet, the doctor may put you on what's called like a gluten challenge diet to add gluten back in small amounts just to see how your body reacts. And then some of the tests include blood tests looking for antibodies, HLA genetic tests, which is specifically looking for the HLA DQ2 and HLA DQ8 genes. If you don't have those genes, then it's very unlikely that you'll have celiac disease. And then they may also do an endoscopy, which is normally their last step, just since it's a little bit more invasive. This will allow the doctors to visualize the villi, and they'll take a biopsy for examination. They're specifically looking for villi atrophy, and then they're looking for high amounts of lymphocytes. And then I have a little picture showing you what your villi will look like. So I have over here, gluten destroys the villi, leaving the intestinal wall with no fibers to absorb vitamins and minerals from the food you eat. So here on the left, here's a normal villi. They're nice and long so it can absorb. And then they're right over time, they become damaged and flattened by celiac disease, so then they can't absorb anything. Who gets celiac disease? So it is estimated to affect 1 in 100 people worldwide. 2.5 million Americans are undiagnosed and are at risk for long-term health complications. Some risk factors are family history. So people with a first-degree relative like a parent, a child, or a sibling are at a 1 in 10 chance of developing celiac disease. You may also be at a high risk if you have an autoimmune thyroid disease, type 1 diabetes, IgA deficiency, or an inflammatory bowel disease. Management, it's a relief for a lot of people that you can strictly manage this by eating a gluten-free diet. So I have a little acronym here to help you remember which ones are gluten containing. So just remember BROW, B for barley, R for rye, O for oats, and then W for wheat. And then if the disease is causing malabsorption, then dietary supplements like calcium and iron may be necessary. And then they may also prescribe some steroids to decrease inflammation or antidiarrheals to help treat some of your symptoms. And then some complications of celiac are anemia, increased risk for developing tumors, specifically T-cell lymphoma, hyposplenism, osteoporosis, neuropathy. Dermatitis herpetiformis is the most common skin disorder with celiac, but you may also get eczema, psoriasis, acne, chronic dry skin, hives, and alopecia. And then over here on the left, I have a little picture of what dermatitis herpetiformis looks like. It's just like really dry, scaly skin. It can be really itchy. And then I have some foods that contain gluten. So I told you before the main goal is to avoid wheat, rye, oats, and barley. And then here are some of the most common gluten containing foods: white and whole wheat bread, baked goods like pastries, cake, pie, donuts, muffins, and cookies, flour tortillas, noodles, snack foods like pretzels, granola bars, cereal bars, chips, and candy bars, and then condiments like soy sauce, salad dressings, ketchup, marinades, and spice blends. And then some gluten-free options. There are a lot of naturally gluten-free things like fruits and vegetables, legumes, gluten-free grains like quinoa, wild rice, corn, and brown rice, animal proteins like eggs, meat, poultry, fish, shellfish, and dairy products, nuts and seeds, healthy fats like oils, um, healthy fats and oils like yogurt, cheese, olive oil, avocado oil, and coconut oil. And then with the rise in gluten sensitivities, there are more and more brands and restaurants that are catering to people with gluten allergies, and they're coming out with even more gluten-free options. Like if you look on a lot of, especially chain menus, they'll have like gluten-free options on there. Some nursing interventions are ensure the patient is adhering to the gluten-free diet, administer medications as prescribed, encourage an increase in fluid intake to prevent dehydration since they are having more diarrhea, and then try to limit them from drinking cold beverages because it can increase their intestinal motility. So it can just make them have more diarrhea. For severe diarrhea, they may be started on NPO, and then they'll gradually increase to a more diet as they can sustain it. And then some patient teaching. I have some examples for y'all, but just make sure that they understand the long-term effects if they don't adhere to a gluten-free diet. Teach them how to read labels. So I'll show you here. I have a couple boxes of things that are gluten-free. So you're looking for two specific things on gluten-free boxes. You're either looking for this certified gluten-free right here or this one. It also says certified gluten-free, but it's just a different label. So you want to make sure that you have those on there because they're certified, so they for sure don't have any cross-contamination in them. They're not sharing any workspaces with any other foods that may contain gluten. Teach them how to read labels. Teach them to speak up and ask questions in restaurants. So make sure they know exactly how their food is being prepared. So like if you're at a Mexican restaurant, make sure that your tortilla chips aren't being fried in the same oil that the flour tortillas are fried in, just little things like that. Make sure that there's no shared workspaces. They can even have a reaction to something as small as you may order something that's gluten-free like chicken and green beans, but they may use the same knives or utensils or cutting board as gluten containing items, so it can cause cross-contamination and that can make them have a reaction. Make sure that they know that. And just let them know that it may be a learning curve, learning to eat gluten-free, but it is doable. There are a lot of recipe books and Facebook support pages out there that have a ton of people that are eating gluten-free as well, and they'll give you a lot of advice on how to eat gluten-free. And then I use a gluten-free scanner app where you just, whenever you're in the store, you can just download it on your phone. Whenever you're in the store, you just scan the barcode on the food item that you're shopping for, and it'll pop up immediately and tell you if it's gluten-free. That's the easiest way instead of having to read labels. All right, and that is all.